So this means a state or whatever can go to Canada and buy your drugs for a fraction of the price that they're charging right now. Massive numbers of tremendous numbers. Florida wants to do it. Colorado wants to do it. Many states want to do it, and they will be doing it. But that's still higher than the favored nations. So as favored nations kicks in, I think that probably beats everybody, no matter where you are, no matter where you're trying to buy. This will be a game changer for American seniors, and by allowing you to do this through Canada, we're doing it very, very quickly. So it goes very fast. And the new rule goes into effect as of today. Is that fast enough? I think so. What do you think? Congressman. The America First health care plan includes another historic provision to benefit our great seniors. Under my plan, 33 million Medicare beneficiaries will soon receive a card in the mail containing $200 that they can use to help pay for prescription drugs. Nobody's seen this before. These cards are incredible. The cards will be mailed out in coming weeks. I will always take care of our wonderful senior citizens. Joe Biden won't be doing this. And this is also partially because of the tremendous money that we're going to be saving with the favored nations and various other things that we've done. We've approved more affordable generic drugs than any administration in history. I had no idea, but I have had many doctors who I have great respect for, by the way, come to me and I said, well, what's the difference between this and this? One is a very well-known name. One is just a pill in a bottle with no tag on it. And they said, zero. I said, must be a little bit better, right? The name Zero. And yet the name brand will cost 5 and even 10 times more money than the generic. So we've approved more generic drugs than anybody at a rapid pace too. We're also requiring that low-income patients receive the benefits of government discounts on insulin and the EpiPen. And that, that is a big deal. That is a big deal. Insulin is one of the most common medicines for seniors. And this is something that SEMA worked on so hard. Insulin prices soared under the last administration, like you wouldn't believe, right, SEMA? Under my plan, hundreds of thousands of Medicare patients will see their insulin costs capped at just $35 a month. That's a 66% cost reduction. And this feature will be available on over 1,600 Medicare plans that seniors can begin signing up for starting October 1st. And under certain circumstances, SEMA, it's literally almost free. This insulin, which they were just ripping you on, is close to being free, even lower than the $35 a month. So you did a fantastic job in that. Thank you very much. And SEMA would come to my office, sir, I have something so exciting. She worked on that for a long time and getting that done, but it is exciting. If you need insulin, a lot of people were going without it. They just couldn't afford it. Now they can definitely afford it. We'll accelerate our relentless effort to save seniors money on their premiums. Since I took office, we reduced Medicare Part D premiums by 12%. Medicare Advantage premiums are also down dramatically, a 44% reduction in North Carolina. That's good. 43% lower in Pennsylvania, and a 54% lower price in Michigan. So that's something, and we have them all over the country. All over the country, there are numbers just like that. We'll ensure that all seniors pay the same price for the same service, whether at a hospital, a surgery center, or a doctor's office. This will save seniors billions and billions of dollars a year. We're talking about the billions. And it also saves our government a lot of money, but will save our senior citizens billions of dollars a year. Fantastic job. We're putting into place the largest package of saving for seniors of any administration in history. No administration is even close to what we've done. And I've said it, having to do much more than even health care. There's no administration in its first 3.5 years that's done anywhere close to the things we've done. And I never even get criticized for saying it. That must mean it's true, right, my congressman and my great senator? Under the Democrat plan, costs will skyrocket. Our seniors will lose the benefits they paid into their entire, they've been paying for their entire lives, tremendous amounts of money, all to finance socialism and open borders. We're just helping other countries that aren't even friends of ours. But we help our friends, and we help socialism all over the world, and we hurt our people, and we're not doing that any longer. As long as I'm president, no one will lay a hand on your Medicare. Your Medicare is going to be safe, and it's going to be solid. The final pillar of America First healthcare plan is better care. That's better care for American patients. The historic action I'm taking today includes the first ever executive order to affirm it is the official policy of the United States government to protect patients with pre-existing conditions. So we're making that official. We're putting it down in a stamp because our opponents, the Democrats, like to constantly talk about it, and yet pre-existing conditions are much safer with us than they are with them, and now we have it affirmed. This is affirmed, signed, and done, so we can put that to rest. They'll say it anyway because it's disinformation. Disinformation. Same thing goes for Social Security. You remember during the last campaign 4 years ago, they kept saying I was going to destroy Social Security. I made Social Security stronger, better. They will be the ones that destroy Social Security because they're going to destroy our country. They will destroy our economy. So Social Security, nothing happened. I keep saying, whatever happened to Social Security? Remember, he is going to immediately attack. No, just the opposite. Your Social Security is 100% with me, but it's not 100% with them. Any health care reform legislation that comes to my desk from Congress must protect the pre-existing conditions or I won't sign it. And I made that pledge, last week, but now I'm making it in writing. We're putting it down, and we have it signed, and we have it sealed. The new Democrat lie is that they will cover pre-existing conditions, but in truth, the socialist takeover, economic shutdowns that they talk about, if you look at this state, frankly, where you have Democrat governors, Democrat leaders, those states are in very, very bad shape with all of their shutdowns. Pennsylvania, you take a look at what's going on in Pennsylvania with the shutdown. We just won a big court case where a judge, great federal judge, ruled it unconstitutional what they were doing. They're hurting people. There's damage on the other side of a shutdown. People don't realize with suicides and drug use and all of the alcohol. It's a terrible thing that happens. And Michigan's another state. The shutdown is very severe. By the way, on November 4th, I'm sure everything will be open. They'll announce on the evening of November 3rd that we're opening up, unless these unsolicited ballots don't come in for weeks and weeks and weeks. You know, they want them to come in over a long period of time. It's going to be a very interesting day. November 3rd, it's going to be a very interesting day. And coverage for illegal immigrants will collapse. Our economy will collapse under their system and make your healthcare system totally insolvent. You know that as great doctors and people that do this, you know that. What they're doing is socialized medicine. And it's not acceptable. It's going to be a disaster in terms of quality and cost. It'll ruin our country. Under their plan, you'll lose your doctor again, and you will lose your coverage. You will lose everything having to do with what we're talking about on my watch. I will never let the radical left take away your health care. You'll always have health care. The America First health care plan will deliver another long-awaited reform. We will put you in control of your own medical records. We'll require doctors to make your records available electronically, and you'll own them, and you'll control them, and they will be portable, and you'll be able to work seamlessly with all of your medical providers. It'll make your life a lot easier, much, much easier. The previous administration led by Sleepy Joe Biden, spent $35 billion and failed to get it done. You know that $35 billion where they failed, we are delivering to give critically ill patients access to life-saving treatment. I also signed Right to Try. You know what Right to Try is. To me, Right to Try is so great. It's so great. And what I think I'd like to do, I'll do it really quickly. I'm going to run through just a quick list of accomplishments that we've done. And, you know, we've really become the healthcare party, the Republican Party, and nobody knows that. The news doesn't talk about it. But I'm going to just say, it's a list of things that we've done, and it'll go quickly, but I just thought I'd take it out. I said, you know, I'd like to read that to the audience of professionals today. And this is just a partial list. We repealed the individual mandate, eliminated Obamacare's health insurance, medical device, and the Cadillac taxes. That's a big deal. People forget all of this. They say, I wonder who did that. Could it have been Joe Biden? He doesn't know what it is. Expanded association health plans, increased availability of short-term limited duration plans, expanded health reimbursement arrangements, big deal, lowered prescription drug prices, and you will see them at a level that you'll never see this again. They will go down so low. And as I said, we had the largest annual decrease. We had the only decrease over a 52-year period. More generic prescriptions approved, saving America an estimated $2.6 billion in the first 18 months of the administration alone. So in 18 months, we saved $2.6 billion with generic drugs. Signed 4 executive orders to lower prescription drug prices. Signed legislation banning pharmacy gag clauses. Does that make sense to you? I mean, what people were under and what even the pharmacists had to do was it was embarrassing to them. Took executive action to ensure price transparency in healthcare. That'll be one of the biggest things, and most people have no idea what it means. I said, some people said that's bigger than healthcare. Required hospitals to post standard prices on the internet. Modernized and strengthened Medicare with more options, more benefits, and lower premiums substantially. Improved kidney care, such a big deal, with more transplants and better treatment. Kidney care is so tough for people with a problem. Very substantially lowered the price of insulin, as we said, for our seniors. Invested in advances in generic therapy for sickle cell disease. Big thing, big thing, big thing. Launched a $500 million initiative to find cures for childhood cancers, $500 million. Combated drug demand. We really went very, very strong on drug demand and the opioid crisis with expanded access to medication-assisted treatment and life-saving naloxone. Opioid prescribed decrease by over 35%. So if you look at the opioid, obviously, horror show, it decreased by over 35% since January of 2017. We've worked very, very hard on that. Launched findtreatment.gov to connect those with substance abuse disorder to treatment. We have an incredible situation. It's findtreatment.gov. Passed Right to Try to give critically ill patients access to life-saving cures where it hasn't been approved yet by the FDA. Incredible. And by the way, many of you know what that has meant. We have had some examples of success that on Right to Try that have been amazing. Launched an initiative to end AIDS, HIV/AIDS in America. We think in 6 years it will be largely eradicated. Who would have ever thought? And this could have started 2 years before I got there, but they chose not to do it. But we have, and we've launched the initiative. It's into its almost 4th year. And at the time we did it, it was going to be 10 years. At the end of 10 years, now 6 years, we're already down to 6. It will largely eradicate AIDS, HIV/AIDS in America. Who would have thought that? It's incredible. When I first heard about it, I said, why wouldn't they have started it early? But they didn't. Expanded access to telehealth, especially in rural and underserved areas, telehealth. Signed historic VA choice legislation. That's a big deal. That's a big deal. And it's the real choice, not the weak choice, the very, very weak, the choice that didn't mean anything. But it's been a tremendous success, and we just got a 91% approval rating from our vets, the highest we've ever had by a lot, the highest. And we also, while we're at it, we signed accountability, VA accountability. That's where people don't love our vets. If they don't take care of our vets, you couldn't do anything about it. They'd have to live in hell with these vets, with the people that we're supposed to be taking care of. And we have a thing called VA accountability. They're accountable now. If they don't treat our vets great, if they don't take care of our vets, if they don't love our vets, our country, we can fire them. We can say, you're fired. We can fire them. VA accountability. That's a big thing. So VA choice, VA accountability. Took executive action to prevent veteran suicide and launched the 24-hour veteran hotline for suicide. And it's really working. And signed the largest ever increase in child care development block grants. Those are just some of the things that we've done. We've done actually a lot more than that, but we have to get back to business here, right? Those are things that we've done, and nobody has any idea. When you look at a list like that, Democrats have never done anything like that. Under the Democrat socialist agenda, an avalanche of regulation would extinguish the flame of excellence that makes America the center of scientific discovery, groundbreaking treatment, and life-saving cures. In our all-out war against the virus, we've lifted bureaucratic barriers and marshaled America's scientific, industrial, and technical brilliance, and we do have total brilliance. Some of it's in this room, by the way, in case you don't know. I will apply, it really is some of the people, right? Right, Bill? Some incredible people in this room. I'll apply the same determination to accelerate medical breakthroughs in all areas, including for Alzheimer's, diabetes, generic treatments for sickle cell disease, early detection of cancer, and much, much more. Already to improve care for Americans with kidney disease, we enable patients to receive at-home dialysis, and we're investing in the creation of an artificial kidney. We're getting very close. And we introduce critical incentives to make more kidneys available for transplant, a change that will save tens of thousands of lives. What people have to go through with kidney disease is incredible. It's incredible. They work so hard. I said, how do they do? They can live a long life, but it's so much work to do it that they literally, one doctor told me that they die of hard work. It's such a job to go and, I guess, dialysis, et cetera. It's such a hard job that they die of literally, they die of just hard work. It's incredible what we've done there and what we're doing, and especially with some of the research that's been done, what we're coming up with. You'll be seeing it very soon, I believe. As we invest in the future, we will permanently bring our medical supply chains back home. We will produce our medical supplies, pharmaceuticals, and treatments right here in the United States, right here in North Carolina. We're going to bring a lot of business to, if you remember, Puerto Rico used to do it, and then they brought tax legislation that destroyed that whole thing. They all left, but they were very happy in Puerto Rico. We're going to bring it back to Puerto Rico and many of our states that will be doing it. And North Carolina, I see, is on the list as being a very top one, so we're going to bring it back to North Carolina and the country. And we'll reverse the disastrous and heartless decision Joe Biden made in 1996 to shut down the pharmaceutical industry in Puerto Rico. It took place in 1996. Biden shut down the whole Puerto Rico industry. This was a very good industry. They were doing a fantastic job, and one day it was just literally gone. Biden shut it down with what he did with taxes, and it was a disgrace, but we will bring it back. Under our leadership, American medicine will make the biggest breakthroughs, the largest leaps, the most exciting strides, and the most outstanding discoveries. Before I sign a historic executive order implementing this ambitious agenda, let me introduce two Americans, great Americans, who will benefit from our policies. Julia Strathopoulos was born in Freeman-Sheldon syndrome, with the Freeman-Sheldon syndrome, which is tough, an extremely rare muscle and bone disorder. Under the previous administration, Julia's family saw their premiums on the individual market skyrocket to $3,000 a month and more. Her parents had to go without a health insurance just to afford coverage for their children. Since I was elected, their family's premiums have been slashed by more than 40%, and we're going down further. And everyone is now covered, and Julia always has access to the doctor she needs. Julia, we are with you. I don't know where you are, Julia. Where is Julia? Wow, thank you. Thank you. You look great, Julia. Thank you. That's great. Thank you, Julia. It's a great story, but we're inspired by your courage. Thank you very much. Also with us is Sharon Leader, a financial planner from nearby Concord. After spending less than 24 hours in the hospital and receiving a few basic tests, she received surprise bills that added up to $4,000. That's a lot of money, despite having insurance. Sharon, those days will soon be over because we'll end surprise medical billing once and for all. Where is Sharon? Hi, Sharon. That's why they call it surprise billing. She got home and she was surprised. They sent you the bill, you opened it up, you thought it was going to be $25, and it was a little more than that, right? That's great. Well, we're taking care of it. Thank you very much, Sharon. We're standing up for our people. We're standing up to special interests. We're taking on the powerful lobbyists. We're stopping the radical socialists and communists, to be honest with you. I think we've gone a little bit above socialism, or below it, if you want to call it that way. But we are standing up to both, whichever one you want to choose. And we are fighting for the incredible people of North Carolina. They're incredible people, people I love. I love the people. We named, as you know, my grandchild is named Carolina. So. Right? Beautiful Carolina, my most beautiful child. But we're providing better care and more choice at a lower cost, substantially lower cost. We're delivering a healthier, safer, brighter, and more prosperous future for every citizen in our magnificent land, because we are proudly putting America first. That hasn't happened for a long time. On behalf of all Americans, I will now sign the executive order. I want to thank you all for being here. God bless you. God bless North Carolina, and God bless America. Thank you very much. Thank you. That's a lot of work. That's great. Hi, Julia.